Hello everyone, bienvenidos. Hope you're all doing well. I appreciate all your hard work in class. You're doing a great job. Just keep up the good work. And remember, keep practicing. You can do it. You'll be fluent. It's just a matter of time or practice, but you can't skip the practice part. So again, that's what these videos are designed to help you do. They're designed to help you practice. So we are going to practice doing a patient interview with symptoms that take the verb tener. So we call these tener expressions. So let's go ahead and get started. Normally, if you ask the question, ¿tiene usted?, it means do you have? And some of these expressions will translate literally as do you have? But sometimes when you translate them or interpret them back to English, the English expression would use the verb to be, are you? So let's go ahead and take a look at some of these expressions. If you want to ask someone, do you have a cough? Do you have a cough? The word for cough is tos. So you'll ask the question, ¿tiene tos? ¿Tiene tos? Again, the usted is implied here. ¿Tiene tos? ¿Tiene usted tos? ¿Tiene tos? La tos means a cough or cough, coughing. So ¿tiene tos? Are you coughing? Do you have a cough? ¿Tiene tos? Do you have dizziness? Do you have dizziness? Tiene mareos. Tiene mareos. Los mareos means dizziness. Remember, you could also ask the question, ¿está mareado? Or se siente mareado? Do you feel dizzy? Are you dizzy? Tiene mareos. Tiene mareos. Do you have sweats? Tiene sudores. Tiene sudores. Tiene sudores. Do you have sweats? Do you have an appetite? Tiene apetito. Tiene apetito. Tiene apetito. Do you have an appetite? Do you have diarrhea? Tiene diarrea. Tiene diarrea. And notice that these are all nouns that we're using after we ask the question with tener. Do you have a runny nose? Do you have a runny nose? Tiene la nariz suelta? Tiene la nariz suelta? Suelta or suelto literally means loose. So do you have a loose nose? Meaning runny. Tiene la nariz suelta. I have would be tengo. Tengo. So if the patient is describing their symptoms, they might use tener expressions. I have a cough. How would you say I have a cough? Tengo tos. Tengo tos. I have an appetite. Tengo apetito. Tengo apetito. I don't have an appetite. No tengo apetito. No tengo apetito. No tengo apetito. Notice when you negate a verb in the present tense, we put the no right directly before the conjugated form of the verb. So if I inserted a subject pronoun, for example, the yo, I would say yo no tengo apetito, yo no tengo apetito, but we're leaving the yo out in this case, because we don't need it. No tengo apetito. The patient has would be el paciente tiene or la paciente tiene. So if you're having to describe the patient's symptoms to someone else, notice the form is tiene. The patient has. The patient has diarrhea. El paciente tiene diarrea. La paciente tiene diarrea. You have to roll your R here. Diarrea. La paciente tiene diarrea. He is cold. To be cold is actually a tener expression in Spanish, so we use tener and frío. So he is cold. Él tiene frío. Él tiene frío. He is cold. Él tiene frío. She is thirsty. This one is tener sed. Sed, S-E-D, sed is thirst. So she is thirsty. We literally have to say she has thirst. Ella tiene sed. Ella tiene sed. She is thirsty. Ella tiene sed. This is where we can't translate literally from English to Spanish because it comes out wrong in Spanish. To express the idea of someone being thirsty, you have to use tener and sed, the expression tener sed, to have thirst. We are hot, meaning we feel hot. Tenemos calor. Tenemos calor. Tener calor means to be hot or to feel hot because the temperature is hot. They are hungry. Another tener expression, tener hambre. Hambre is hunger. So in Spanish, we don't say I am hungry. We say I have hunger. That would be tengo hambre. But here, they are hungry. Ellos tienen hambre. Ellas tienen hambre. Ellos tienen hambre. Ellas tienen hambre. Okay, so just some more tener expressions. Escalofríos is chills. So if you want to ask somebody, do you have chills? You would say, tiene escalofríos. Espasmos, spasms. So tiene espasmos. Do you have spasms? Colic or menstrual cramps. Tiene cólicos. Do you have colic or do you have menstrual cramps? Muscle cramps are calambres. And the notation here, M and PL, means masculine plural, so it would be los calambres, los cólicos, los espasmos, los escalofríos. So again, do you have muscle cramps? Tiene calambres. Cramps in the abdomen would be retortijones, or sometimes speakers will use the expression retorcijones. Tiene retortijones, tiene retorcijones. Do you have cramps in the abdomen? Are you itchy or itching? In English, we would use to be, are you itchy, or are you itching? Do you have itching, maybe? And so in Spanish, tiene comezón. Some speakers will also use the expression picazón, tiene picazón, and those are both el comezón, el picazón. And some speakers might use the word rasquera, tiene rasquera, and this is la rasquera. So tiene rasquera, tiene picazón, tiene comezón. Do you have itching or are you itchy? And a few more here. La garganta inflamada. Do you have an inflamed throat? Tiene la garganta inflamada. Do you have a fever? Tiene fiebre, calentura. Do you have indigestion? Tiene indigestión. Tiene indigestión. Do you have a stuffy nose? Tiene la nariz tapada. Tiene la nariz tupida. To be cold. Are you cold? Tiene frío. Are you hot? Tiene calor. Do you have a runny nose? Tiene la nariz suelta. Are you hungry? Tiene hambre. Do you have broken bones? Tiene huesos fracturados. Okay, and those are just some of the tener expressions. Those aren't all of them. Okay, well that's it for this video. Remember, challenge yourself. Go back to the beginning of the practice part and keep playing the video until you're able to correctly guess all of the answers before I show them to you. And then you've really learned something. That's it for this video.